here to know more about her life, biography, and also her educational background. I let Miss Lydia to explain that to you.
So the life story of Nola Pender. She was born on August 16, 1941 in Lansing, Michigan to parents who advocated education for women. In 1964, she took up her bachelor's degree in Michigan State University. In 1965, she took up her master's degree in Michigan State University. So she is a co-founder of Midwest Nursing Research Society.
So Pender's health promotion focuses on two concepts, which are the health promotion and the health protection or disease prevention. The health protection focuses on behavior-motivated, desire to increase well-being, approach to wellness, while the health protection or disease prevention focuses on behavior-motivated, desire to avoid illness, early detection, and maintain function of illness exists. The first concept, which are the health promotion, is defined as behavior motivated by the desire to increase well-being and actualize human health potential. It is an approach to wellness. Well, the second one is the health protection or illness. It means prevention is described as behavior motivated desire to actively avoid illness, detect it early, or maintain functioning within the constraints of illness.
So health promoting behaviors are desired outcome when providing client care and education. So health promoting behaviors may be defined as an action directed toward attaining positive health outcomes such as optimal well-being, personal fulfillment, and productive living. So examples of health promoting behaviors include eating a healthy diet, exercising regularly, managing stress, gaining adequate rest, enhancing spiritual growth, and building positive relationships. So nurses in all practice areas have numerous opportunities to encourage health promoting behaviors related to presenting concerns and anticipated health challenges. So Pender identifies the following factors as having a potential influence on the health promoting behaviors of clients. So whereas the first two items on the list, the prior related behaviors and personal factors, are difficult or impossible for nurses to change. So the other factors listed can be influenced positively by nurses through effective assessment, support, and education. So Pender's factors include the following. So the first factors is the prior related behavior. So the prior related behavior refers to the past frequency of behaviors. So the more frequently a behavior was done in the past, the more likely it is that the behavior will continue in the future. So the second one is the personal factors. So personal factors include biological, psychological, and sociocultural factors that directly and indirectly influence health promoting behaviors. So the biological factors include age, gender, body mass index, onset of puberty or menopause, aerobic capacity, strength, agility, and balance. While in the psychological factors include self-esteem, self-motivations, personal competence, perceived health status, and individual definitions of health. And in the social cultural factors include race, ethnicity, cultural identity within a large culture, educational opportunities, and socioeconomic status. So next is the perceived benefits of actions. So perceived benefits of actions are the expected positive outcomes of the proposed health promoting behavior. So for example, a teenager may be prompted to quit smoking after the nurse comments that smoking causes teeth to become discolored, and that after quitting, teeth will remain whiter and healthier. Okay, so this is the perceived barriers to action. So perceived barriers to actions are the real and imagined barriers to health behavior change. So for example, financial limitations might make it impossible for a client to maintain a membership at a gym. So that is a real barrier. So another client may be able to pay for the gym memberships only to be thwarted by an imagined barrier such as everyone will laugh at me and stare at me every time I go to the gym because I am not in physical condition. So that is the perceived barriers to action. So next is the perceived self-efficacy. So perceived self-efficacy refers to the personal judgment about motivated. So that is the first is self-efficacy. Next is activity-related effect. So activity-related effect is refers to negative and positive behaviors associated with actually doing the health-promoting behavior. So for example, if a person resolves to walk a while during lunch break every day at work and finds that the result is fatigue and unpleasant sweaty work clothes, then the feelings associated with the actual activity of walking for fitness at work may be negative. So that is the activity-related effect. So next is interpersonal influences. So interpersonal influences refers to how the significant others around the client affect motivations for positive change. So these influences include expectations, social support, and modeling by family, peers, and healthcare providers. So if a client lives in a household where all the adults smoke, then smoking associations will be more difficult than if the client is the only adult who smokes and the rest of the family would prefer for the client to quit. So that is the interpersonal influences. Next is situational influences. So situational influences refers to external factors that affect the client's perceptions of the proposed health-promoting behaviors, such as where, when, and how the activity will take place. So for example, if a client is asked to attend a nutrition education class in the lobby of a candy store, so the smell and inviting appearance of the candy might make it impossible for the client to commit to a weight loss program unless the competing demand on the reciprocal candy is removed. So that is the situational influences. So next is the commitment to a plan of action. So commitment to a plan of action refers to the person's intentions to change and the creation of a plan of actions to accomplish the implementations of a health-promoting behavior. So clients are more likely to engage in health-promoting behaviors when they anticipate realizing specific benefits from the activity. So that is the commitment to a plan of action. So next is competing demands. So competing demands are behaviors over which the client has little control because they are associated with necessary life activities such as work or family care responsibilities. So for example, if a client had to choose between leaving a child home alone to go to the gym or staying home with a child, so most parents would choose to stay home rather than leave the child alone. So in this situation, exploring exercise options that would include time spent with the child and may be more effective in the long run than attempting to complete an exercise regime at the gym. So that is the competing demands. So next is competing preferences. So competing preferences are those choices over which a client has a high degree of control. So such as whether to eat an apple or a candy bar for an afternoon snack. So education regarding healthy rather than poor food choices would enable the client to adjust personal preferences and make better informed decisions that would support healthy eating behaviors. So that is the competing preferences. So the last one is the health promoting behavior. So health promoting behavior, this is an endpoint or the action outcome directed toward attaining positive health outcomes such as optimal well-being, personal fulfillment, and productive living. So
The next one would be relevance of health promotion theory. This focuses on well-being before illness or disease. Disease exists on prevention focus. Individual or community geared promotes well-being, healthy lifestyles geared towards any age group, and goal is equals to positive outcomes. Well, the future incorporation to nursing practice is use of the model relies on both nurse and patient. Also a limitation. HPM has been used since 1980s and can be used in almost any practice. Preventive approach will save money and like for example, diet, exercise, screening, vaccine, wellness checkups, and BP monitoring. We have here Pender's quote. She says that I committed myself to a proactive stance of health promotion and disease prevention with the conviction that it's much better to experience exuberance well-being and prevent disease than let disease happen when it's avoidable and then try and cope with it. And the last one would be the references.
participation in care, cure, and core aspect of patient care. Care is the sole function of nurses. Cure and core are shared with other members of the health team. She was a mentor, motivator, mentor to nurses in all phases of their careers, and advocate for chronically ill patients. She worked to involve the community in public health issues. Education. In 1927, she's graduated from New York Hospital School of Nursing with diploma in nursing. In 1932, she entered Teachers College at Columbia University in New York and earned a Bachelor of Science degree in Public Health Nursing. In 1942, she resumed her education and received a master's degree in the teaching of natural life science from Columbia University. Career and appointment. Lydia Hall's nursing experience was functional, proficient, as well as hypothetical. Spent her early years as a registered nursing working where the main focus was on preventative health. Worked as the first director of the Lloyd Center of Nursing. Her nursing experience was in clinical nursing, nursing education, research, and the supervisory role.
So now let's proceed the Lydia Hall's theory of nursing, the care circle. Nurses are focused on performing the noble task of nurturing patients. This circle solely represents the role of nurses, and it focuses on performing the task of nurturing patients. Nurturing involves using the factors that make up the concept of mothering, care and comfort of the person, and provide for teaching learning activities. The care circle defines a professional nurse's primary roles such as providing bodily care for the patient and helping the patient complete such basic daily biological function as eating, bathing, eliminating, and also dressing. The nurse's role also includes educating patients and helping a patient meet any needs he or she is unable to meet alone. This represents the nurse and patient with an opportunity for closeness. As closeness develops, the patient can share and explore feelings with the nurse. So the care circles, it focuses the body, the natural and the biological science that intimate bodily care aspect of nursing. The next one, the core circle. The patient receiving nursing care. The core has goals set by him or herself rather than by any other person and behaves according to their feelings and values. It involves the therapeutic use of the self and it's shared with the other members of the health team. This area emphasizes the patient's social, emotional, and spiritual and intellectual needs concerning family, institution, community, and the world. And also, it can help the patient verbally express feelings regarding the disease process and its effects by using the reflective technique. Through such expression, the patient can gain self-identity and further develop maturity. So this circle, the core circle, focuses the person, the social sciences, therapeutic use of the self aspect of nursing. The cure circle. The cure is nursing, which involves the administration of medication, treatments. Hall explained in the model that the nurse shares the cure circle with other health professionals, such as physicians or physical therapists. These are the interventions or actions geared toward treating the patients or whatever illness or disease he or she is suffering from. During this aspect of nursing care, the nurse is an active advocate of the patients, and the core circle focuses the disease, which the pathological and therapeutic sciences that seeing the patient and family through the medical care of aspect of nursing. The hosts are three aspects of nursing, which is the person, the body, and the disease. The assumptions. Hall's care, cure, and core theory assumptions are: first, the motivation and energy necessary for healing exists within the patient rather than in the healthcare team. 2. The three aspects of nursing should not be viewed as functioning independently but as interrelated. Number 3, the three aspects interact in the circles representing them change the size depending on the patient's total course of progress.
So these are the host theory and nursing meta paradigm. First is the individual. The individual human who is 16 years of age or older and past the acute stage of long-term illness focuses on nursing care in Hall's work. The source of energy and motivation for healing is the individual care recipient, not the health care provider. Hall emphasizes the individual's importance as unique, capable of growth and learning, and requiring a total person approach. Next is the health. Health can be inferred as a state of self-awareness with a conscious selection of optimal behaviors for that individual. Hall stresses the need to help the person explore the meaning of his or her behavior to identify and overcome problems through developing self-identity and maturity. Society and environment. The concept of society or environment is dealt with concerning the individual. Hall assumed that the hospital environment during treatment of acute illness creates a difficult psychological experience for the ill individual. Loeb Center focuses on providing an environment that is conducive to self-development. The focus of the nurse's action is the individual. Any actions taken concerning society or the environment are to assist the individual in attaining a personal goal. And lastly is the nursing. Nursing is identified as participating in the care, core, and cure aspects of patient care. Care is the sole function of nurses, whereas the core and cure are shared with other members of health team. The major purpose of care is to achieve an interpersonal relationship with the individual to facilitate the development of the core.
So next, the Hall's theory on the nursing process. Assessment. It involves collection of data about the health status of the individual. The individual increased awareness of feelings and need in relation to health status, increased ability for self-healing. The assessment phase pertains to guiding the patient through the cure aspect of nursing. The health team collects biological data, which are the physical and laboratory, to help the patient and family understand the progress through medical regime. Nursing diagnosis. The statement of the patient's need or problem area. How a nurse envisions the nursing role influences the interpretation of assessment data and conclusion reached. Viewing patient as the power of self-healing directs conclusion differently that if the healing power rests in the physician or nurse. The patient is the one in control, the one who identifies the need. Outcomes or the planning. It involves setting the priorities and mutually establishing patient-centered outcomes and goals. The patient is the best person to identify outcomes, set goals, and arrange priorities. The role of the nurse is to use reflection to help the patient become aware of and understand needs, feelings, and motivation. The nurse works with the patient to help keep the goal consistent with the medical prescription. The nurse draws on a knowledge base in the social and scientific areas to present the patient with creative alternative from which to choose. Implementation. It involves the actual institution of the plan of care. Professional nurses use a permissive, non-directive teaching learning approach to implement nursing care, thus helping the patient reach established goals. The nurse also helps patients and family through the cure aspect of nursing that works with the patient and family help them to understand and implement the medical plan. Evaluation. The process of assessing the patient's progress toward the health goals. The evaluation phase of the process is directed toward deciding whether or not the patient is successful in reaching the established goals. Thank you for listening, and that will be all. Thank you.